Dr. David Stoker, board-certified plastic surgeon in Los Angeles, here with our approximately 50-year-old gentleman who flew in from the East Coast a few months back. And we did several very interesting procedures on his face as kind of an introduction to plastic surgery. It made an enormous difference for him, and I just wanted to walk you through those. First, we did upper and lower eyelids. Will you close your eyes for me? It's got a little tiny incision up here, and go ahead and open now. One of the things that the guys in particular, even more than women, want to emphasize is that they look very natural. They really don't want to look done. In his case, he has very heavy brow, heavy eyelids, so much so it was causing fatigue and causing him to be sleepy earlier in the day because of the weight of holding his eyelids up. So it really brightened his eyes. When we show you the before and afters, you'll see the tremendous amount of light that now gets into his eyes, so you can see what color they are, and much nicer looking. The second thing is removing the fatty bags underneath the eyelids here. He's a hard-working guy, and it made him look like he was working too hard, I think, as those bags got more prominent underneath. So what I like to do most of the time is, instead of removing skin on the lower eyelids, which can cause problems such as pulling down the lid, what I do is I evert the eyelid, make an incision behind it, and tease out a little bit of fat. That helps to reduce that bag. The third thing I did for the eyelids is a fractional carbon dioxide laser resurfacing. What that is it basically takes away the outer epidermis and a portion of the superficial dermis, in this area in particular, and where the skin can get crepey and have fine wrinkles, it tightens it up quite well. It's safer and more effective than the older type of surgery where you cut out the skin and remove it. So it worked really well for him. The other thing is that he carries a fair amount of the weight on his body in his face, had kind of puffy cheeks, and it exaggerated his jowls. So we did several things in his lower face to improve his appearance. We took out some of the buccal fat pad here through, go ahead and open your mouth for us, on the inside of the mouth, inside that cheek, made a little incision up here through which I was able to, go ahead and close, remove a little bit of the fat in here. Makes him appear more angular, leaner, fitter overall, and I think it had a very positive effect on him. The next thing we did is a chin implant here. Through a little incision underneath, gave him a stronger jawline, which helped to diminish the significance of his jowls in this area, and tighten some of the skin down here, give him a much better neckline. And then the final thing we did is a little liposuction of the neck in here. Now you can see it's very lean in this area. We cleaned out all that extra fat, so if you turn to the side here, go ahead and turn away from me a little bit, you can see how much more angular he is in this area, whereas just the way that he distributes his fat, he didn't have much definition of his jawline before. It just kind of blurred in this area, I would say, and without doing a bigger procedure such as a neck lift or facelift, because his skin elasticity was pretty good, I think we got a relatively profound improvement for him. It makes him look younger, fitter, and probably had a positive effect on his overall lifestyle and helping him to encourage him to maintain it. So I'm happy to have him back on the West Coast here for a bit for an assessment of his post-op results. And thank you for sharing.